When NTV visited Entebbe Regional Referral Hospital, the National Water and Sewerage Corporation had disconnected water supply earlier in the day for non-payment of more than 488 million shillings. Notices demanding payment had been served to the hospital a while ago. The hospital, which was elevated to regional referral status, serves a population from 6 districts like Wakiso, Kalangala, Butambala, Gomba and parts of Mukono. The administrators grappling with the situation lamented that the funds that are released to them are insufficient to cover the mounting bills.
For this year, we have already remitted 120 million to National Water, which is our annual allocation to cater for water utilities.
With no water, numerous services have been suspended.
We shall not operate. Because to operate a patient, we need water. We shall not, most of the areas, we shall close them down because they need to have water. Like I said, patients need to use toilets, even attendants need to use toilets, and when there is no water, the toilets cannot work.
The hospital found itself clinging to reserves, but the meager water supply cannot sustain them even for a single day, and they have to find other means.
What we think we can do is maybe to get emergency water from Fire Brigade of Uganda Police.
Dr. Henry Mwebesa, the Director General of Health Services in the Ministry of Health, acknowledged the crisis and confirmed that there are ongoing discussions with the Ministry of Finance and the National Water and Sewerage Corporation. He also pointed out that the connection of staff quarters to the hospital has blown the water bills for some health facilities out of proportion.
So we have emphasized that staff houses should be disconnected from the main hospital bill. But we also try to advise our hospitals to prioritize their bills, because you cannot sit there and wait that somebody will come to your rescue. You should be able to keep paying your bills with the money you have.
The situation mirrored that of Naguru Referral Hospital, which has also suffered a week without water and has been forced to suspend several services. The desperation spread as other facilities received disconnection notices, compounding the already dire circumstances. A letter from Ministry of Finance to the Managing Director of National Water and Sewerage Corporation, dated 1st June 2023, indicates that the ministry had noted that outstanding areas have been verified and governments will make appropriate provisions to clear the areas in the medium term. And given the importance of these facilities towards saving lives, the ministry requested National Water to reconnect these facilities with commitment that the required funds will be provided. In response, a letter dated 2nd June, the corporation apologetically declined the ministry's request, emphasizing the impact of unpaid bills on their ability to deliver services and meet obligations. The State Minister of Finance, Henry Musasizi, acknowledged the crisis as a result of poor planning.
You budget for 10 billion and the actual expenditure is 15. It is basically, the major cause is poor planning on the side of budgeting, which we are going to look into and resolve.
Nonetheless, he reassured the public that discussions are underway.
Just to get it from me, we are going to pay the bill and the hospital will run normally.
When should we expect it? It's been 1 week.
As soon as possible.
Members of Parliament gave their views.
I must congratulate National Water and Sewerage Corporation for the brave decision taken to disconnect these agencies, because surely when we make this budget, most of these MDAs come up with their BFPs. We appropriate funds that are supposed to cover for everything, electricity, water and other utilities. So, but because most of these MDAs, they sit on their roles and pretext on thinking that because this is a government institution, they will divert the monies into other sinister things, cause losses in the sister agencies like National Water.
Whoever is responsible for the budget of the hospitals, whoever is responsible for the budget of those ministries and other agencies, let them pay for those utilities, because honestly, we budget for them. If Minister of Finance is not releasing money for utilities, they should think twice and release that money immediately.
So there is no reason as to why National Water cannot be paid. If they have a deficit in their budget, what should they do? This is the amount, this is the money that is used to purify the water and also to extend the lines to different people that need this water in the villages.
Utilities like electricity, like water, and so on, really should not be cut off abruptly like that. Instead, the parties concerned should sit down and negotiate.
On 2nd May, while speaking to journalists, Silva Mugisha, the corporation's managing director, said that government ministries and agencies owe more than 19 billion shillings in unpaid water bills from July 2022 to March this year, over and above the existing 43 billion shillings areas that the Ministry of Finance has accepted to budget for and to clear. Norbert Atkunda, Entebbe News.